I really did want to be a doctor all my life. I really can't explain why, except that I knew that I had to do something with my life, and I didn't want to pursue a career where I was making money just for the sake of making money. I wanted it to be for a higher purpose, and clearly helping people is that purpose. And I was laser driven, to use a pun, my entire life to go to medical school.
Personally, I went to college and to medical school to become a pain management physician, based on, a personal family experience with my grandfather. So I've always been of the opinion that treating pain aggressively is appropriate. It's been very rewarding that the Accuroscope procedure has greatly expanded the population of our patients, that we can offer a potential complete cure. Cure meaning getting rid of the pain that they're currently suffering from their current back problem.
For me, it was always a fascination. It was a scientific fascination, how the body worked, what went on. The idea of medical school was and still is, a tremendously exciting, fascinating thing. It's some of the most exciting times of my life was the new part, the introduction to medicine and medical school. There's a lot of great things about it. A lot of people in their lives, I'm not sure they like what they do. They watch the clock. Well, I don't. At least I never do. To this day, I'm glad I'm a doctor.
This can help restore a doctor's enthusiasm and idealism, because patients are grateful. It really gets to the core of why I, and hopefully every other doctor, goes into medicine in the first place, because we're doing something that isn't hurting anybody, isn't making a problem worse, and many times turning their life around by treating the problem.
They're legitimate people in chronic pain that's affecting their lives, and up to this point we basically could use medications to try to control the symptoms, with all the attendant side effects and problems that go along with taking medications every day, to the various injection things, which are going to wear off over time. None of them are a fix. It's basically trying to put out the fires when things have flared up, but it doesn't treat the underlying cause. But now we actually have a way to try to treat the underlying cause and give people long-term relief without having to go through a chronic pain program.
Some of the patients tell me or ask me right after surgery, is the very first thing they say, so I really had a reason for pain. I can tell everybody I wasn't faking it. And that's so sad, but that's what happens because of an MRI, whereas I can go in and actually find what's causing their pain and prove for the patient and their family and significant others that they really are suffering, that they really do have good reason for their pain. And then, of course, being able to treat it and help them return to their active, functional lifestyle is the most gratifying thing that could happen to anybody. That's what we're here for, is to help other people.